Hi, everyone. Thank you for joining. I see we've still got a good number of people signing in, so we'll give them a moment to get settled. We've got a lot of content, but we'll give everyone just a moment here, and we'll get started very soon. Thanks. All right, everyone. We'll go ahead and get started. First, thank you for being here today. This is a challenging, difficult time for everyone. We are excited to share with you today. We've got a lot of good content lined up. It'll probably take us the full hour here, which is good. But want to thank you for setting aside the time. A few things before we get into the presentation. First, a quick intro. My name is Justin Everett. I'm the Vice President of Marketing at Solution Reach. And our main presenter today will be Addison Reed, who's our Customer Education Manager. So in addition to having the most amazing beard in the Mountain West, Addison also has a lot of really good experience to draw from and share with you guys. He's been just a valuable Solution Reach member and is really involved in our community and working with practices who have questions and are wanting to accomplish certain goals within their practice, but he's also worked in dental practices as well. So I think you're going to find his perspective to be really helpful here. Just a couple of housekeeping things before we go in and I turn it over to Addison. One, remember this is a 4-part series. So today is sort of, we think of this as like the overview session for the practice comeback plan. But we'll have, and I'll send show you the dates here toward the end of the session. Just a reminder that we'll have 3 more weeks of sessions where we'll go into each of the 3 what we're calling phases, and you'll be introduced to those here shortly. So if you can't make a session, if this is the only one you can make, that's okay. But just by signing up, we're planning to send everyone a recording after the session. We'll plan to send these slides as well. So that's typically a question we get. Can I get a recording? Can I get the slides? We'll send you both. And these slides, when we export them as a PDF, you'll be able to click on a lot of the links in here. And for those of you who are Solution Reach customers today, there's some really good knowledge-based articles that are linked, and you'll see those throughout. Second, because of the amount of content we're getting to today, we won't have a live Q&A. We're hoping to do more of that in the next few weeks as we go into the deep dive sessions by phase. But that's not to say you can't ask a question. If you have a question, there are a couple of ways you can ask. One, if it's a support-related question and you're a customer, I would recommend visiting community.solutionreach.com and clicking on My Support. There's a lot of really good articles you can search there and maybe go ahead and get your answer. A second option is there's the questions panel in GoToWebinar itself. And even if we don't have time to address that, we'll be able to keep a log of any questions that you asked, and to the extent we can, we'll try to make sure that we're sharing those and getting you some answers. So that's that. And also, obviously, an invitation to connect with us on different social channels. We're sharing a lot of this content, a lot of the helpful stuff there. So moving ahead. So our agenda today. 4 things we want to go through. One is what we're thinking of at Solution Reach and what we embrace as what we think the keys are to success during this downturn and how you're going to come out of it. And then Addison will walk us through each of these phases, what we refer to as the urgent phase, which is the right now, the recovery, and then growth. But before we get into that, I want to share some thoughts on what's Solution Reach's take on this and how you're going to thrive. And some good content we've seen from the Harvard Business Review is during downturns, businesses that you know, have the best growth rates coming out of a moment like this, even though this is unprecedented, have three characteristics in common. One, they take action early. And you guys, just by being here and being a part of this webinar today, you've already taken step one. You're already getting involved in acting, and that's fantastic. Second is taking a long-term perspective toward this. So thinking about, you know, it kind of goes in with number three, thinking about how can I grow rather than just think about cutting costs. And a challenge that I would have for everyone here is, how do you, I mean, is it possible? I believe it is. How do you emerge from this COVID crisis that we're all going through? How do you emerge as a stronger practice than you were going into it? And I think we're being forced to do some things differently, but there's some opportunities that are coming from that are going to stick, and we're going to go through those as well. And I just want you to encourage you to think about that as we go through the content here. How do you emerge coming out of this as a better practice and better serving your patients, better operationally than you ever were before? Because everyone's in the same boat here, right? We're all going through this. So if you act early, you think with a long-term perspective, you focus on growth, this is probably an opportunity to separate yourself if you put your competitive hat on. From the competition, this could be an opportunity to separate. So just something that, you know, I think that's the solution reach view, and I think I'd encourage you to keep that in mind as we're going through this. So I'm going to turn this over to Addison here, and this is, I'll kind of jump in here and there and ask some questions, but this is what we think of as the phase one to this. A lot of you guys, a lot of what Addison will share here are things maybe you're already doing or things you haven't quite thought of doing, but this is the urgent. This is, you know, let's don't wait on this. Do this stuff now. And Addison, I'll let you take it away.
All right. Well, I've been really excited to get into this content. This has been something that we've been gearing up for a good amount of time, and I'm really excited that so many people are here on this webinar. And I really want to thank all of you for what you're doing to take care of your patients and taking the time right now to kind of be on this webinar with us and learn from us and from our experience. Now, I know we have customers as well as non-customers on this webinar. So when we're going through each of these, if there's something that looks really specific to the Solution Reach platform and you don't happen to be using Solution Reach, that's okay, because a lot of these principles will still apply to the services you may already be using. So this first particular service we want to talk about is right now, the phase that many of you are in. We need to deactivate any of the outbound automated messages. So what does this look like?
Hey,
Addison,
Addison, can I interrupt real quick?
Always.
It sounds like you may have music playing in the background. Could you check real quick?
Sure.
We are doing this remotely, and we're all in this together, right, guys?
Yeah, let me double check. I don't believe I have anything just around me locally, but let me double check again. Are you still hearing any of that music, Justin?
I don't hear anything. We just had a question or comment come in. All right, press on. We'll see if that's been resolved.
All right, maybe it's just my melodic voice. Maybe that's what it was. All right. So this first one, deactivating automated messages. This might look like automated appointment reminders or automated recall messages, or if you have an automated newsletter campaign that's sending out at different intervals, whatever that looks like for your practice, we recommend deactivating those messages because right now you're kind of in this standby mode. Say that again. Was that you, Justin?
Nope, go ahead. You're good.
Okay, sorry. All right. Thanks everyone for bearing with us with these fun little experiences of the audio things. So what this does is as you deactivate these, this will help minimize any confusion for patients, especially if your practice right now is maybe it's fully closed down. You're not seeing or treating patients at all, or maybe you're on a bit of a limited service. You're seeing only emergency patients, so you kind of need to go day by day or week by week potentially. Whatever that looks like for you, this is what we recommend as the first step. Deactivate those automated messages, and many of you have already done that. So I think with that, we can jump to our next slide. You've deactivated messages. Well, now what? The next thing you might want to start doing, if you haven't already, is making sure that you're tracking any appointments that you need to cancel, because ideally you want to get those same patients back on the schedule down the road, right? At some point, this is all going to, return to a version of normal that we are used to. And you need to make sure that you have this list of these cancel appointments and patients so that you can fill your schedule when it's time to do that. So it's important to make sure that you are aware of where your patients are at in their treatment. And again, like we said, you can use that list to help fill the schedule when reopening, so it's not such a mad dash or an absolute scramble when your office is back open again and you just have a schedule full of emptiness, right? We don't want that to happen. So this is a great way to sort of plan ahead and be prepared for that. On our next slide, we highly, highly, highly recommend that you leverage two-way texting. Whether this means using SR Conversations for a solution reach customers, or if you have a different tool that you're using, texting is the most preferred way that patients, they want to be communicated with through that medium. Email is fantastic, but honestly, it's second to texting. And it's the reason that texting is so great is because it also allows that your practice, or you, if you're the one doing it, to handle a lot more of these interactions and these communications with much greater efficiency. I remember back to my time as an office manager, we didn't have this option. And anytime that we want to reach out to our patients, we didn't even have the option to email them. For us, it strictly meant picking up the phone and dialing a number. And it was extremely time consuming, and it was very hit or miss. We didn't have a great way to track who was contacted besides writing it down on paper. So texting is a fantastic way. It's the recommended way to reach out and communicate with your patients during this time.
Addison, I just want to comment. I love it as a patient myself. It's just an opportunity for me to feel like I have someone I can reach out to and a way to do it,
Yeah. No, you're absolutely right. It's convenient for patients, right? If my doctor said, "Hey, Addison, we need to, shift your scheduled appointment," and he tried to contact me right now, well, I can't take a phone call. I'm on this webinar with all these great, professionals, but a text would really help me out, because then I could take a look at it and respond to it on my time. This is, again, it's convenience for your patients. It's convenience for you as well. So this is a big one. You've got to let your patients know how they can reach you in case of an emergency right now. If your practice is performing limited services right now, get the message out through any way that you have at your fingertips, whether it's email or text, social media, changing something on your website, even adjusting the voicemail message that patients hear when they actually call into your practice. And another thing that will help is defining what an emergency is. I know that a lot of us can probably imagine some of our different patients who might think the smallest thing is an emergency. And while it may seem like an emergency to them, it's really important right now to prioritize the actual emergencies, so that you can treat the patients that are actually truly experiencing something that is vital to their health, versus someone that maybe they can wait a little bit, or they can perhaps use a different method to communicate with your practice or with the provider to determine what that actually is, if it actually is emergency level. And I think that's thanks, Justin. You're helping us out here. Another thing is, if you've never sent a newsletter of any kind to your patient base, now is a great time to jump in and send more newsletters than perhaps you've ever sent before. A lot of us can probably look at our inbox right now and see a ton of emails from people that maybe we haven't done business with in years, but they have our email on file, so they reached out to us and said, "Hey, here's what we're doing right now during COVID-19. They're trying to help us, be reassured." And so you can do the same thing with your patients. And this may mean increasing the frequency at which you send those newsletters. Maybe you're sending it to specific groups of patients, which we'll talk about in just a moment. But send information that's up to date for your area. Your patients are looking to you to be a source of knowledge. They're looking in a million other places, but some of those places may not be quite as reliable as the type of information that you may be able to provide. And again,
Yeah, Addison, just to make a comment, I really love this recommendation, because like many of you out there, I feel like I'm getting COVID updates from anyone I've ever done business with. I collect vinyl records, and the company that I have a subscription for, but that is sending me COVID updates. I mean, just really everything under the sun. But the ones I'm paying attention the most to are updates from my healthcare providers. That's who, I mean, and with all the media and everything and information going everywhere, this really is an opportunity to be a source of truth and a trusted source of information for our patients. So I love this recommendation.
Yeah, you're absolutely right. It's another way, another touch to help provide a sense of information and a sense of calm outward to your patients. So it's really important to just use every method that you have at your fingertips. So we talked a little bit about setting a newsletter. Well, let's talk about something that maybe you can include in the newsletter, the type of information. And our next slide shows us some of the things that you might need to do, or some of the places you might need to visit, so that you can stay up to date with the latest announcements or things regarding COVID-19. Whether it's the World Health Organization's website or the CDC, if it's the ADA, that's another fantastic one, especially with all of the dental offices on this particular webinar today. Whatever you determine is the best place. We think this is a pretty good list so far, but you may be thinking of other ones that are even better. Use those resources and populate that message outward to your patients so that they can look to you as a source of reliable and trusted knowledge. So we talked about this too, as far as sending newsletters. Maybe you're sending messages, not just newsletters, but maybe any type of message you're sending out to different types of groups of your patients, whether that means your entire patient base, whether it's patients that have scheduled appointments, if you're still happen to be open and seeing patients and providing services to them, or maybe you want to send messages out to high-risk patients, maybe those who have been, who are of a certain age or above, or those who have certain medical conditions that may make them high risk. This is a great way to really personalize the messaging, to those patients. Like Justin said, he's getting emails from all these different places, and the same thing's happening to me, and I'm sure to many of you. And it's great they're doing that. All these different businesses are trying to communicate with us, but you can kind of tell this is kind of just a big blast message, and it may not feel extremely personal. You as healthcare providers and those working in healthcare offices, you have an opportunity here to go that next step further and to make your patients really feel like they're part of your practice's family, that you really are aware of their situation and you're doing what you can to personalize the messaging towards their situation. That goes a long way. Speaking as a patient myself, that goes a long way as a patient to really provide me a lot of peace of mind.
Addison, something to note here. We've got Solution Reach customers on the webinar today, but also those that aren't. For those of you who are customers, again, just to remind you, if you popped in late, we are planning to send all of the slides from today as well as the recording, and all of these blue underlined sections that you see on your screen. When this PDF of slides comes through to you, you should be able to click on those. And for those of you who are Solution Reach customers, these are linking you out to knowledge-based articles, we call them KBs, on how to go do these things. So if Addison's talking about creating different patient group segments, high-risk patients with appointments, what have you, you'll be able to click the links here and figure it out, follow the article and pretty easily be able to do this. So just wanted to make that point for those who joined the webinar a little later.
Yeah, thank you, Justin. I really appreciate that. So this next topic is implementing telehealth or teledentistry. The Office for Civil Rights and the Centers for Medicare and Medicaid Services, they have had some updates to some of their policies regarding the types of billable procedures and the types of services that can be provided and the method in which you can provide those services. So when you're looking into this, and this is a great time to do this, especially if your practice is closed down, it's a great time to do all this research and take into account what your office can do, what you can provide to your patients. The ways that Solution Reach can help with this, once you have that type of service established, you can take those links that might be related to telehealth appointments, you can populate those into the different types of messaging provided through Solution Reach or through whatever service provider you're using. whether it's sending things out through, again, email, text, or other methods. Maybe you're making them available on your website. For those of you who are using Solution Reach, you can create a digital patient intake experience using SR Intake. You can stay connected with your staff using SR Huddle, which is part of SR Conversations. And these are great ways to help implement that telehealth process and experience for your patients.
And this is something, Addison, too, that for those who are able to join next week, as we deep dive into what we're calling this urgent phase, we'll spend more time here kind of showing a little bit of the how and maybe some screenshots of how you can do that with the Solution Reach platform, because this is obviously super high visibility, how you implement telehealth, how you implement teledentistry, and we want to spend more time diving into that with you guys when we come back next week.
Yeah, again, great point there, Justin. Again, just to help reiterate, we are, it might seem like we're flying through all these slides, but we are going to go into these in much more depth in the upcoming weeks. So we're excited for all of you to join us on those upcoming sessions. So the next topic is sending pre-visit instructions. For those of you that might still be open and are still seeing patients for emergency procedures, these are types of messages that may go out at the same time as your appointment reminder. And this is a great opportunity to throw in messaging, that goes around some of the symptoms for COVID-19. You can add these messages in there, and type something along the lines of, are you experiencing any symptoms? If you are, please contact us before you come in for your appointment. This is a really good way to help keep you and your staff safe, as well as other patients who may be visiting the practice. We already talked about leveraging text. Well, now we're going to talk about text payments. There are options for your patients to pay via text out there. Solution Reach, we provide this option through SR Pay, but this is another great way to reduce the amount of face-to-face human interaction that needs to happen in your practice. You can send out these payment reminders to your patients and say, hey, in this case, here's an example of someone sent me one. Hey, it looks like you need to pay $25. Click on this link. We'll give you an access code. You can pay it quick and easy from the comfort of your own home. And you don't need to, come out to our practice or even call us up. It's a very great convenience for patients and for you as providers. Now, since we have a little bit of downtime, potentially, right? Most of us probably aren't as busy as we were a few weeks ago. This is a great opportunity to sharpen the axe, as they say, to hone your own skills. You can, if you're a Solution Reach customer, you can access Solution Teach University right from our community, and you can get these certifications that are going to help you be ready and be more prepared to communicate and serve your patients as we continue to go through these different phases. So in that university, we have the basics of patient relationship management, the basics of patient communication as well. They're extremely powerful and useful resources to help you out. Looking into financial resources, this is a very important aspect to keep you and your staff safe and healthy financially as well. You might look into some of these different options, such as the Paycheck Protection Program, or potentially small business loans that might be useful for the situation your practice is in. And Justin, I think you had something you wanted to say on this regarding Skip. Is that right?
Yeah. So we know, many of you obviously are all over this already, but it's obviously, we thought it's worth reiterating here. But something that I wanted to point out is a partnership that we have in place with YoGov and a service called Skip. There's $400 billion available in forgivable loans from the SBA right now, and this stuff feels like it's changing on a daily basis. So what Skip is offering is that they'll kind of go give you personal assistance to help you apply for those programs if you need that help, and also some ongoing support there. So you can copy this link. We'll leave it up for just a second. You can copy this at the moment, or be sure to click on it when we send this out afterwards. But that's something to check out. They'll help you apply for all of those loan options, help you monitor the loan status, and even over the next couple of months, make sure you're aware of any opportunities. So a pretty cool resource here, and something we wanted to be able to share. And to that point, Addison, this is kind of that's kind of the phase one urgent piece. I wanted to share this. We have another link here. This is our marketplace, and these are some different partners that we work with. DM Score, great dental websites, My Social Practice, etc. Any of these are good options to check out. This is the time where any time and money we've got, we want to really invest it wisely. And there are, beyond the scope of what Solution Reach can do and what Addison has suggested, there are some different options you may be looking into or wanting to explore in terms of getting your website really tightened up, or having an even stronger social media presence. As we go forward, we're messaging now and we go forward. These are things, these are a part of our messaging programs and our messaging strategies to patients, right? Having a really good website, having good social media, etc. So I'd encourage you to go check out what we call the SR Marketplace via the link below, and you can sign up to get some more information about these services from those groups. So I think worth your time if you have it. So going into what we're calling phase two, this is the recovery. Okay, we've done all this stuff we need to do right now to just kind of weather the storm for the moment. Well, when are we ready to reopen? And we have some recommendations for you guys here, and it's hard to put a timeline on it because who knows what this is going to be, right? I mean, and practices may differ based on geography and how COVID is playing out. So what we have are some good recovery phase options and recommendations depending on when that is for you. But I think what's important here is to really get off to a good start. That's going to be the difference between just kind of surviving and easing out of this and coming out of the door as strong as we can and really starting to thrive, which is our phase three. So with that, Addison, I'll turn it back to you and let you talk through some of the recommendations in this recovery phase, so to speak.
Yeah. And just to touch on what you were talking about, Justin, you're exactly right. We don't really know the landscape of how things are going to play out. We don't have any timelines on anything. The only thing that we can sort of rely on here is the landmark of at some point we're going to reopen. And it's important to do as much as you can to prepare for that day, whenever it might be, so that you're not scrambling at the moment that your door's open to do all these different things and rush. It's important to be prepared ahead of time. So with that, in this recovery phase, you have to create a safe and a healthy environment, not just for your patients, but also for your staff. So this might mean making sure that everything in your office is completely deep cleaned, it's supplied, down to the simple, nitty gritty things are, do you have something that takes AA batteries? Are the batteries fresh in it, right? You don't want to have anything that's going to come up and slow you down as you reopen. If any of you out there have ever been present at a practice while you've opened a new location, you know how stressful that can be. We've been kind of talking internally, this is kind of like reopening your practice, but you have a lot of great advantages because you have a huge patient base that already loves you and they want to come back and be treated there. So as far as keeping your staff healthy and safe emotionally, this might mean increasing the amount of staff meetings you have so that you can get everybody on the same page. It might mean regular one-on-one meetings with individual staff members to check in on them, make sure they're doing okay. And where possible, it might mean making your schedules a little more flexible to accommodate patients, to accommodate staff. Our staff are patients too, and that might be initially, at least, as a lot of different providers open back up for normal services, your staff might need to get in and see providers as well for their own types of treatment.
Yeah, Addison, I think this staff safety is such an important point right now. I mean, very well, we're facing this as a business, as a software business ourselves, and you and I work on the same team. It's huge, this emotional support for one another. Having we have staff meetings more frequently where we can't be in the office together, but we look at each other a lot. I get to see that big beautiful beard every day, and we're having one-on-ones and trying to be reasonable with flexibility with schedules. So I think this to me is a really important point. You want the safe, healthy environment from the physical side, of course, but just to make sure we're all going forward and on the same page as a staff, and we're more in tune with one another emotionally than we've ever been, I think is very important. So I like this recommendation.
Yeah, you're absolutely right. That's just seeing the faces of my team members on a video call every day is really, really helpful for boosting just my own mental health. So this next step is you need to determine the priority of the patients. Now, if you happen to be open right now, you're most likely doing a pretty good job of that by finding out who are the actual emergency patients that need to be seen. If you have patients on the schedule as is, keep as many of them on the schedule as you can, because this is going to reduce the work for you down the road when you're back to full, ready, and open status. And when you are developing a priority for rescheduling those patients, you might want to think about, first rescheduling those who missed appointments due to you being closed. You might want to consider dedicating specific days to treat high-risk patients. You might even want to look at extending your hours, whether this is extending, your hours later in the day, or maybe being open on days that you aren't typically open, just to help your practice ramp back up and to be, really available to your patients, so that they can be seen at their convenience. These are different options or different ways you can think through this. Again, like Justin said at the very beginning of this webinar, this is a great opportunity to think way outside the box, way outside of things that you used to do or were comfortable with. This is a time for change, and your patients can benefit really greatly from that. You also need to let your patients know that you're open when it's time. And we talked in the previous phase about getting out the message through text, through email, social media, your website, anything that you have at your fingertips. You got to do it again when you reopen. You got to get the message out and let people know, hey, you can come in for appointments. It's not just emergency treatment only at this point. You got to, ideally, you include methods for them to schedule or request appointments so that they can do that at their own convenience. And that may mean sharing some sort of link through those different methods to allow them to request appointments at their convenience. That's going to help you as you're proactively sending messages out to patients, letting them know you're open. Having that message just up in a public space is going to allow them to do that and filter in normally as they would. And as you're getting patients on the schedule, you may want to make some adjustments initially. We don't know, like Justin said, we don't know how any of this is going to pan out, how long we might be in sort of a pseudo recovery phase, with limited services being provided. So you may want to add more time between appointments to give yourselves, enough time to really thoroughly, wipe down or clean treatment rooms or whatever it might be, to, again, provide peace of mind to your patients and to keep your staff healthy and safe as well. And a lot of us out there, we have cancellation policies to help reduce our patients' no-show rates or our late cancellation rates. This is a great time to be a little more flexible and a little more understanding with those policies. We highly recommend you take it on a case-by-case basis. Your patients are in the same boat as you are when you're not at the practice. You're a patient too. So think of how you would want your providers to help you and treat you in these difficult times. All right, the reminder cadence. 333. This is something we've been talking about for a while. If you are a Solution Reach customer, you may have heard of it. If you aren't a Solution Reach customer, you may have heard of it as well. This means setting your appointment reminders to different intervals, specifically 3 weeks, 3 days, and 3 hours prior to the appointment. And the reason for this is that when you have your appointment reminders set up at those 3 different intervals, this results in a 156% increase in confirmation rate. If you're a practice that struggles with confirmation rate, this is one of the easiest ways to solve that problem. Whether you're whether you're open right now or whether you're getting ready to reopen, whenever that may be for you in your state or in your local area, getting this set up prior to opening is going to really help drive that confirmation rate. It's going to help reduce those no-shows and cancellations without having to really hardly enforce or really strictly enforce that cancellation policy. This is a much more subtle way to drive those. You may need to add or update those pre-visit instructions that we talked about in the previous phase. You may continue to have that same messaging that's asking about symptomatic experiences that patients are going through, whether it's cough or fever, or shortness of breath, whatever it might be. You may need to update those depending on what the situation your practice is in. And
And
again, yeah,
Addison, if I could add real quick, I know we've still had some people logging on. So again, these underlined sections here of creating pre-visit instructions, editing existing, when you get these slides afterwards, you'll be able to click on these and it will show you how to do this in the Solution Reach platform. And I know we knew we had this in the phase 1 recommendations, and again, just to reiterate here in phase 2, you'll have good instructions for how to go do that and make sure you're getting in any language that you want your patients to see or kind of help scan or screen for ahead of the visit. So this is really valuable.
You beat me to it, Justin. I was just getting ready to say that. And if you don't happen to have a way to automate this process of sending out this type of messaging at the same time as your appointment reminder, maybe this is something you take on and manually do. As you confirm patients, you're asking them these questions so that you can help provide some of that screening experience. When they arrive for their appointments, this is another point at which you can do a little bit of pre-screening. You can take this, we have created a COVID-19 questionnaire for those of you using SR Intake. You can add this to your intake packet so that it's part of the entire experience that a patient goes through when they come into your practice and they fill out their digital paperwork. Excuse me. We're also
or before they come, Addison.
Yeah, ideally that would be the situation. It'd be before they even set foot in your practice, especially now, right? To help with those social distancing recommendations that we've been receiving. We also are going to be providing, one of our assets that we're going to be providing is a printable version of this. If you don't happen to use Solution Reach for your intake process, we still want to provide you with a resource to get this done so that you can help treat your patients and keep them safe and healthy and keep yourselves and your staff safe and healthy as well.
Thanks, Addison. And so we'll move into what we're calling the phase 3 here, and this is the growth phase. So we've taken care of all the urgent stuff we've got to do right now. We're kind of surviving the moment. Now we're ready to reopen and recover and come out strong out of the gate. Well, how do we thrive moving forward? And we don't know what this is going to look like, but there are some predictions we feel pretty good about regarding, Addison talked about what's normal going to be. Well, it's quote unquote new normal, right, guys? So 3 predictions we have here is one, the practices that thrive, or one, they're going to really remain focused on not just the safety of their patients, but the safety of their staff as well. We talked about that emotional connection and ability to communicate and stay in sync and stay on the same page with our staff, even as we emerge from COVID, because this is gonna be a long process, and we're gonna have, even if the practice is up and running and thriving, there's still personal things with my kids in school, and I gave a child a haircut last night, guys. That's the first time I've ever done that in my life. Talk about pressure. But second, aside from the staff, it's going to be about providing patients with more convenient ways to connect with their providers and receive care. So if I'm a patient, from the comfort of my home, can I text in a question? Can I ask a question without needing to be seen? What can I cover in a more convenient way? This is forcing our hand on some of these things, but I think a lot of it's going to stick. And then the third one here in this new normal is just keeping a really open mind. Like Addison said, there's maybe things that we haven't done before, that now is the time. This is the time to embrace change to the extent we can, and adopt and experiment with new technologies and tools. And here we say there's no more, well, we've always done it this way. Well, this is never, we're in a brand new world here, guys. This is a new normal. So I think to thrive going forward, these are some points we need to keep in mind and think through that as Addison's sharing some of these recommendations.
And just to add to some of that, Justin, as well, those of you who are already using some of these new technologies, these new methods, you're ahead of the curve. Those of you who maybe have put it off a little bit, you may look at yourselves right now and kind of have that stark realization of, okay, we need to change. This is our chance. This is an opportunity to change and to improve and do things that we've never done before, or offer things in ways that we've never offered them before. This is a huge opportunity, a huge growth moment for your practice. So with that, encourage two-way texting. We've talked about this in a previous phase. Texting is the #1 most preferred method of communication. by patients. They want to be texted. Let me deviate for a sec on this, because the practice I was at, we didn't have the option to text our patients. Our owner was very much of the mindset of, well, it doesn't have a personal touch. The phone call has a personal touch. That's great, but your patients largely don't care. They don't care about that. They want what's more convenient for them. They want that text. So being able to encourage that is huge for allowing your practice to move more efficiently and quickly when you communicate with patients. In addition to that, having email, having social media, having a way to quickly update things on your website are incredibly huge for you. Being able to post a physical sign at your practice to encourage that two-way texting experience, or again, adding it even to your voicemail message. Hey, we know that you're calling in, but did you know you can text us? Feel free to do that. This is another great way to help your practice save even more time as you come back from this and begin to thrive. So on this next slide, do everything you can to set up a paperless check-in process. Not just because it's great to save the trees. It is. It really is. But this also helps reduce another way for this COVID-19 to spread and continue to stick around longer than we really want it to. So if you're a Solution Reach customer, you can do that through SR Intake. This is a fully digital process. You can send the intake packet to their phone before they even arrive at the practice. They can fill it out in the parking lot. They can fill it out in their own home, so that when they arrive and they walk in the door, they don't have to sit and wait for 15 minutes while they fill out paperwork. They can walk in the door and walk right back to the treatment room. That would be ideal. If you, whatever this looks like for you, for the solutions that you're using, do everything you can to streamline that process and remove the paper, remove the pens and pencils from that process. And you might even look at incentivizing patients to perform that online check-in before they arrive at the practice. You can tell them, hey, this is going to speed your appointment along. This is going to reduce the wait time for you. We really recommend you do this process. This is huge for you and huge for patients. Another way to improve that experience for patients is to use some method to allow them to request appointments online. This is huge for me. I've got a wife, I've got 2 kids. We are busy. And even when we're not quarantined to our house, we are busy. We are on the go. And I need the flexibility to not have to rely on calling my provider during office hours, because I'm working during those hours. I need the flexibility to request appointments outside of those normal times. This puts a lot of responsibility, and it puts a lot of power in the hands of the patient by allowing them to request appointments. And I say request because with our solution, SR Schedule, patients don't just get to see your appointment book and just start plopping their names in. That's not how it works. They request appointments at specific times that you designate, and you have the ultimate say in saying, yes, we will approve this request. So you still have power. It's not just a free-for-all. The next thing on here, strengthening online reviews. Now, I know how this might look. Some of you might say this is a terrible time to work on online reviews, even if you're in phase 3 when you're trying to thrive again. It really isn't. This is a great time to strengthen those, because you can rely on patients who had a fantastic experience through right now, the phase that we're in right now, where some of you are completely shut down. This is an opportunity to reach out to those patients. You know, the patients that are your star patients, your amazing patients, the patients that love your practice. You can reach out to them and ask for them to share their experiences online. Heck, you don't even have to say, can you leave a review? You can just say, can you please share your experience? You've been at our practice for quite a while, and we would love for you to just be honest and open. And you can use your knowledge of who your patients are to invite to go leave those reviews online. You can use surveys to do that. You can send those invitations via email or text to make it, again, more convenient for your patient. You can incentivize your team. Maybe you tell your staff and say, hey, whoever can invite the most patients to leave a review this week, we're gonna give you 2 tickets to a movie or free dinner or whatever it might be. But you can also put signage up around the practice to help reinforce that idea of, hey, I can go leave a review for this practice. I can go share my great experiences with other potential patients. Now, this next step, this talks about our success formula. This refers a little bit back to the one of the previous stages where you can use some time to sharpen the axe. to learn and hone your skills, in regards to how your practice can run and function more effectively. The SR success formula is something that we've developed, and we've crafted it very carefully, specifically to increase the revenue of your practice. Revenue is fantastic, we all know that, but it's also to help improve the patient experience and to help make things easier for you and your staff. This goes through different things, such as increasing the number of patients that your practice sees, increasing the number of appointments that are seen, reducing the number of no-shows and cancellations that happen, and helping you to replace and reschedule appointments, because we all know cancellations are going to happen. So we talk about that as well. And you can learn all about that again.
Yeah, just to mention, Addison's been instrumental in helping create this success formula and a lot of the educational content around this, and I know he'll plug that as well. But I would really encourage people to go, for Solution Reach customers, you've got access to this. Go educate yourself and go dive into these topics. I mean, it's 4 bullets right now, and we'll spend more time on this in our deep dive session. But there's really a lot of good tactical recommendations and content for each of these 4 areas. And if we're going to thrive, this is great stuff to draw from.
Absolutely. And these principles still hold true. The things that we teach in this training, it still works, even if you're not a Solution Reach customer yet. They still hold true. They still apply. So thank you, Justin. I really appreciate that. All right. So again, just to recap on some of the assets that are going to be available. And Justin, correct me here if I'm wrong, but we're going to provide a practice comeback playbook, a PDF for each of you. We're going to provide checklists for each of those phases. And there's even an opportunity to receive personalized training and planning from a comeback coach.
Yeah, Addison, and thanks for mentioning that. And I'm going to launch a poll right now, you guys. And so these assets that he mentioned, let's see if this launches on the screen for everyone. Taking just a moment. But again, these are in addition to the webinar recording and the slides from today. We'd love to have you guys just kind of say, hey, each of these pieces, it's taking a moment to load here. Just say, hey, I'd like to have these. So if you would just kind of click and say, yeah, I'd like to have the downloadable playbook. It's about a 30-page playbook, checklists for all of the phases. And like Addison said, that notion of a comeback coach and a personalized comeback plan, we'd love to share that with you as well. So want to give you guys a moment, just kind of indicate what additional pieces you'd like here, and we'll make sure we get them to you pretty shortly after the webinar. So I'll give it just another moment. Just a couple more moments for folks. All right. Great. Thank you, everyone. So that's pretty much the content for today. Again, wanted today to be an overview and just start to orient you to what we've developed in terms of this 3-phase comeback plan process. Again, these are all recorded. If we'd love to have you join on the 15th to 22nd to 29th, right? Same bat time, same bat channel every Wednesday for the next few weeks. Jump in. We'll hope to have more Q&A and let you ask some questions there and dive deeper into some of these topics like telemedicine, for example, next week. Again, if you can't make it, that's okay. We want to make sure you get the recordings. But those are our upcoming deep dive sessions, and want to make sure you can attend those. And also, some of you have put questions in the Q&A. I've been monitoring that a little bit. That's great. We'll have people follow up. We mentioned community.solutionreach.com as a place to go get some support answers if there's some technical, hey, how do I do this, that you need. You can certainly go there and click my support and search the knowledge base articles there. That's really good. Use the links that are embedded into the slides that you'll get later. Those link out to a lot of great resources on the kind of the how-tos. But in lieu of that, if you have questions, additional questions, reach out over email if you're a customer. It's community@solutionreach.com. That's different from community.solutionreach.com, which is the website, the community website. But if you're not a customer, We'd still love to hear from you. If you've got any questions, just use our sales email, which is sales@solutionreach.com. You can also call us at 800-995-8444. So that's the session for today. We hope to see you guys in a few weeks. For the next few weeks. Hope this was valuable. Hope you got a lot of good content. Any of the resources that you've requested, we'll be following up with that stuff soon. And again, want to thank you not only for attending today, but for all you're doing for us as patients and for the healthcare community. You're appreciated, and we look forward to seeing you have your practice come back going forward. Thanks very much.